cases. And this is a huge problem because when refugees come to Buffalo, no matter what the service is, they have to make choices that impact their lives overall. But for the purpose of our presentation, we're focusing on the healthcare and the healthcare of women and women seeking medical healthcare and making choices on their medical needs and treatment options. And the absence of language access results in the use of untrained friends and family to address their needs. And in a lot of cases, they use their children, no matter what the age is, to interpret for them at their appointments.
So does anyone know how to read this? Ise konaji munaji yo. So does anyone know what the meaning of this? Exactly. This is how refugees feel. They feel like they are deaf and blind because even when they see the word and hear the sound, they do not understand the meaning of this. My grandma told me that if you're not an educated person, then you're going to feel like you're deaf and a blind person. Also, this was supposed to me. I have a back pain, and the translate is not correct. That's why we need a in-person interpreter. Barriers to have female interpreter. Basically, not enough female interpreters. The problem is we need more female to train to become an interpreter. Also, there is less interest, less information, and they do not know how to become an interpreter. Why do we need more female interpreter anyways? Cultural, norm and tradition, medical privacy. Some female are not comfortable telling their privacy issue to a male interpreter.
All right, so our goals are to encourage language access, especially for adult women refugees, and promote cross-cultural linkages between the refugee communities and providers. So what we want to do is create awareness around improving accessibility services to individuals with LEP. We want to understand and meet obligations to provide language access, want to improve access to interpretation, and develop and distribute guidance and resources on language access training for providers and their staff.
So these are the most refugee population in Buffalo.
Okay, so we have a couple of objectives. The first one is to foster an ongoing partnerships with community organizations and service provider agencies, which means we want to recruit interpreters through this partnership. We want to identify specific measures for annual assessment and collect data. We want to recruit females for professional training so that they can accurately interpret medical terms and others. And we would like to recruit interpreters to work as bilingual staff.
So I urge you to think about the need we are discussing with you. Even with the large refugee population we have in Buffalo, not only we don't have enough interpretation services, we do not have female interpreters when the female is going to her medical appointments. I just want you to think like as females, not only just as a refugee. If you go to an OBGYN appointment, would you like to see another male present there to discuss your medical issues with? So this is why we find it very necessary that we form an association in the form of a group. So what we want to do, we want to create a group that works in addition to the already existing groups, because this issue has been going on in Buffalo, but it's not completely solved yet. The gap is still there. We want to add this group to recruit interpreters. How we want to solve how we want to approach this problem is that we need to increase the number of interpreters. And our main approach is to recruit people. So we're not going to hire interpreters. We're not providing trainings. There are already existing trainings. We want to link, we want to work closely with the refugee community, make them aware, train them where these trainings are happening, how to become an interpreter, encourage them to be part of the solution and become interpreters. And by that, we're not only helping the refugee community, we're supplementing the providers and the overall medical healthcare system with more interpreters. And that approach would be like the way to solve this problem. And we have specific activities to that as well.
For starters, we want to host a series of a few events. One would be in a community center, one would be in a local high school, and a few would take place in places of worship. For example, people from the Iraqi and Syrian community can go to a local mosque, people from other communities can attend their local place of worship. We also want to promote the need for female interpreters in local newspapers such as Caribou News, which touches upon the different ethnic communities, different refugee communities. And we want to get in touch with service providers and make a database for interpreters so that they know where to apply for interpretation work after their interpretation training is over. And this is just a little graph that you can see that would be us in the middle. And these are the places we'd reach out to in order to look for these, look for people who want to get involved with interpretation work.
Okay, just a quick overview what's already been in Buffalo. I already mentioned that there are groups, and specifically these groups are Language Access Plan, which is already implemented in Buffalo, but that focused on the law enforcement use of Language Access Plan. Partnership for Public Good, they always hold meetings, and we think would be a great addition to these meetings. And Jericho Road Family Practice is a great model because they all not only have female interpreters available all the time, they have bilingual staff with them from a couple of different countries. Okay, so speaking of the benefits, by 2018 we are hoping and we think if we accomplish this association and group, there will be a significant increase in the percentage of female interpreters available in Buffalo. More in-person interpretation will be available, and then the female refugee will seek more medical attention. And working with refugees, you have no idea how many families that I've encountered, and I asked a woman, when was your last time a visit to the OBGYN? And I've encountered cases when these women say, I went to Roswell and I found a male, or I went to my family practice and I found a male interpreter. This is forming a barrier. I want you to think with me that this is a problem, and our group will solve this problem, and we think we would be a great addition to all of the language access plans because we are the only group in Buffalo that is giving attention specifically targeting the female interpretation. And this work hasn't been done in Buffalo, and that is very critical. Buffalo has a large refugee population, and women makes up the largest percentage of that. Thank you.
Hello, good afternoon, everybody. So I'm going to be the mic carrier to the judges, and I'm going to start first with our fellows from the community and ask for questions that they might have.
Okay, so in your presentation, one of the last slides about 2018, how long is the interpretation training? How long does it take?
Interpretation trainings depend, so if we speak about the medical trainings, it could be as long as